Hello, doctors. So today we are going to discuss anaphylaxis in a Simman. So let's just briefly discuss how to make a diagnosis of anaphylaxis. So for anaphylaxis to be present, we need two of the three cardinal features of anaphylaxis. That is shortness of breath, swelling of the tongue and lips, and rash on the body. Okay, so if you have shortness of breath, swelling of the tongue and lips, or rash, any of these two, then you can safely make a diagnosis of anaphylaxis. And an anaphylaxis station will also give you a history of a possible trigger. For example, the Simman might tell you that he has a nut allergy and he was in a party and he ate a cake. So, and after that, this shortness of breath started. Or he might tell you that, this blood transfusion started after this blood transfusion was started, and after that, he got this shortness of breath and this rash. Okay, so there will be one of these three features and a history of a possible trigger. Okay. All right, so we all know that to manage anaphylaxis, we give adrenaline, okay? But Simman is the only station where you need to know the exact dose, concentration, and the route of the medication that you are giving, okay? So the main management of anaphylaxis is adrenaline, 0.5 ml, 1 into 1000 in the intramuscularly in the anterolateral part of the thigh. Okay, adrenaline 0.5 ml, 1 into 1000 intramuscularly in the anterolateral part of the thigh. Okay, all right. So to manage the anaphylaxis salmon, as I told you already in the journal approach, that as soon as you enter the cubicle and you verbalize your name and GMC number, you need to look at the monitor. Okay, once you look at the monitor, you will find out that oxygen saturation is low, respiratory rate is high, and blood pressure might be low or it might be normal. Okay, all right, so you know that there's a problem with oxygen saturation, so we will be starting with airway, breathing, and then move on to circulation. All right, so after looking at the monitor, you will go up to the patient and you will ask him, you'll introduce yourself that, hello, my name is Dr. X, one of the junior doctors here. Is it Martha? So the patient will say, yes, doctor, I can't breathe. Okay. So, okay, so the patient will be telling you repeatedly, the doctor, I can't breathe, I can't breathe. So you will tell the patient, first of all, reassure the patient, this is your IPS. So in Simman, as it is an emergency patient and the patient is potentially in life-threatening condition, the patient is potentially dying. So you will, so you need to give a lot of reassurance to this patient that don't worry, Samantha or Martha or whatever the name is, don't worry, I'm here to help you. So your oxygen saturation is a bit on the lower side. So I will need to give you oxygen. Do you have any smoker stuff? Okay. So the patient will tell you yes or no, depending on the, you will give either a non-rebreathable mask or a Venturi mask. Okay. So you will start with airway. You will ask the patient that, can you please open your mouth for me? And when the patient opens his mouth, you will find out swelling of the lips and the tongue. Okay, so you will verbalize that. Samantha, I can see that your lips and tongue are swollen. So I'm going to give you oxygen. And then you will verbalize for the examiner that it seems like my patient has an anaphylaxis reaction as his lips and tongue are swollen, and also he has difficulty in breathing. Okay. So I will give my patient adrenaline 0.5 ml, 1 into 1000 and intramuscularly in the anterolateral part of the thigh. And then we will move to the medicine cart. You will pick up the adrenaline and you will act to give the adrenaline to the patient. Okay. Also, when you ask the Simman, can you please open your mouth for me? You know that it is not a living patient, so he will not open his mouth. He will just like verbalize that and go open his mouth and have a look inside it. And while looking inside the mouth, make sure that you tilt your head and go close to his mouth and like have a proper look so that like the examiner can see that you are actually looking into his mouth. All right. Okay. So when you enter the station and You ask the patient what's going on with you. He will say, doctor, I can't breathe. And then you will start the patient on oxygen. Okay. Before starting a patient on oxygen, you'll ask about smoker stuff. You will also have a look inside his mouth, where you will find swelling of the lips and the tongue. Okay. And then you will make your diagnosis. All right. You'll make your diagnosis and you will give adrenaline. But in some of the stations, there might be a blood transfusion going on. Okay. As soon as you enter the station, you will find that there is a blood transfusion set and the patient is receiving blood transfusion. So when the patient said, doctor, I can't breathe, you need to ask since when. Okay. And he will say, like, for example, 30, since last 30 minutes. So at that time, you need to ask what happened 30 minutes ago. And he will tell you that, you know, a nurse came and she started this blood transfusion. A doctor came and he started this blood transfusion. So what most of the candidates do, they assume that, you know, this is because of this blood transfusion and this is an anaphylaxis reaction. So I need to stop the blood transfusion. Okay. But if you do that, you will seem scripted because you have not made your diagnosis of anaphylaxis yet. The patient is only saying that, you know, I can't breathe and it started 30 minutes ago and it started after this blood transfusion started. Okay, but you need to have a look inside his mouth to find swelling of lips and tongues, or have a look at his chest to find a rash. Okay, so that you can like get 2 of the 3 cardinal features of anaphylaxis, and then you will stop the blood transfusion. That, you know, it seems like this problem started after this blood transfusion. Seem like this is a reaction to this blood transfusion, so I'm stopping this blood, and then you give adrenaline. So if there is like blood transfusion, in that case your first step will be stopping blood transfusion, giving oxygen, stopping blood transfusion, and then giving adrenaline in that order. Okay, giving oxygen, stopping blood transfusion, and giving adrenaline. But before stopping blood transfusion, ask the patient give the patient oxygen and ask the patient that, can I please have a look inside your mouth. And then you need to verbalize that this is an anaphylaxis reaction and I'm going to stop the blood transfusion. Okay, and then you give adrenaline. All right, so don't stop the blood transfusion before having a look inside the patient's mouth and finding swelling of the lips and tongues or rash on his body, because when the patient said, doctor, I have this breathing difficulty and it started 30 minutes ago and it started because of after this blood transfusion. So you cannot be like sure that this is because of this blood transfusion or whether this is an anaphylaxis reaction or not, because only because of a breathing difficulty you cannot label someone as having an anaphylactic reaction. It can be acute exacerbation of asthma, it can be anything else. So make sure that you confirm this before stopping the blood transfusion. All right, so this is your A part. You have given the oxygen. Okay, you have given the oxygen, you have stopped the trigger if any, and you have given adrenaline 0.5 ml 1 into 1000. Okay, intramuscularly. Now when you give adrenaline, the patient will, like, his breathing will stabilize and he will say, thank you, doctor. So, and he will start talking normally. So that is the time where you can take a brief history. So you can say, okay, Samantha, can you please tell me what happened to you? And she will give you like a 1 or 2 line history. The doctor, I started this breathing difficulty and this blood transfusion was started. A doctor, I started experiencing this breathing difficulty after eating a cake or anything, like any history of a trigger or something. Okay, then so you got the history of presenting complaint. After that, you will ask, has this ever happened to you before? Okay, and then you will ask, do you have any medical condition? Right, do you have any medical condition, any other allergies, and are you on any medications? So history of presenting complaint, and the history of presenting complaint, she will like only ask about what happened. She will tell you since when it started and since when it started and how it started. Okay, only these 2 questions. Then, has it happened before? Has it ever happened before? Okay, and then MAM, that is MAM, medications, allergies, and medical conditions. So that is your brief history in case of a Simman. You do not go into much detail as this is an emergency. Okay. So once you ask these questions, it will only like hardly take 1 minute. So after that, you just tell the patient that, Martha, I'm going to quickly complete my assessment. Is that okay with you? And she will tell you, okay, doctor. So after that, you will go on to the breathing part. So in the breathing part, you will do, like, you will tell the patient, I'm going to have it look at your chest, please. Okay, and then expose the patient chest, have a look at it, do inspection. After they do percussion, do palpation. Before doing palpation, tell the patient that, I'm going to touch your chest. If you feel any pain, just let me know. Okay. And after palpation, do percussion. Tell the patient that, I'm going to tape on your chest and listen to it. Okay. And after percussion, do auscultation. Tell the patient that, I'm going to listen to your heart sounds and lung sounds. Okay. And when you place your stethoscope, tell the patient to, can you please breathe in and out for me? All right, but in cases where all these steps are not needed, for example, uh, as in a case of anaphylaxis, you will not probably need like palpation or percussion or auscultation in the initial stages. You might hear a wheeze, but most of the time there will be nothing on auscultation as well. Only on inspection, in cases of anaphylaxis, you will find a rash. Okay, so when you move on to steps like palpation, percussion, and auscultation, so you will start the step and the examiner will tell you assumed. Examiner will tell you all the findings are normal. Okay, he will not let you complete all the steps of examination if that is not needed. Okay, so that will save your time. All right, so after the breathing part or the B part, you go on to the C part. You check the patient's pulse, and then you ask, you like verbalize that I need a fresh blood pressure finding, and the monitor will show fresh blood pressure finding. So if the blood pressure is on the lower side, you start the patient on fluids. Okay. Whenever the blood pressure is on the lower side, or even if the blood pressure is normal but the pulse rate is on the lower side, it's better to start IV fluids, because you will not make a blunder or worsen a patient's condition by starting IV fluids, but you will always make a blunder by not starting IV fluids. Okay, so 500 ml of IV fluids will do no harm to the patient even if not needed. Okay, unless it is a heart failure case. So whenever you find that the blood pressure is on the lower side or the blood pressure is normal but the pulse rate is on the higher side, always start fluids. What fluids are you going to start? 500 ml of normal saline, 500 ml of normal saline over 15 minutes by IV route. Okay. All right. So you'll start the patient on fluids if that is needed. Okay, so that will complete your C part, and after the C part, you will go to the disability part, that is the D part. And as I told you in the previous video, that in the disability part, you need to check the blood sugar level first. Okay, pick up the glucometer and pretend to be checking the blood sugar level of the patient, and the examiner will give you a finding. Okay, which will be normal in cases of anaphylactic shock. All right, so 4 millimolar above glucose level is normal. All right. After checking the blood glucose level, check the patient's pupillary reaction. After that, ask the patient, can you raise your right hand for me? Like, give a command to the patient will follow command. So that completes your disability part. And then tell the patient that I'm going to have a further exposure to have a look at your skin to look at any abnormality. Okay. So now if you find a rash on inspection, the patient is telling you, doctor, I'm still feeling very itchy. What you can do is you can also give the patient injection chlorpheniramine IV state. Okay, injection chlorpheniramine IV state, 10 mg. Okay. So after you are done with all these steps and you are still left with the time, and you will verbalize that, Martha, you had a severe allergic reaction to the blood transfusion. Martha, you had a severe allergic reaction to the cake that you ate because it contained nuts probably, and you are allergic to nuts, or whatever the trigger is, tell the patient. Okay, so we call this as anaphylaxis. I'm going to document this in your notes. Okay. And if this is a case of blood transfusion reaction, also verbalize it. I'm going to document it in your notes, and I'm going to send this blood bag to the blood bank. Okay. And then tell the patient that we are going to admit you today, and I'm going to call my seniors to have a look at you. So as I told you in the previous video, these two things will be like these two things goes for all the patients. Calling seniors and admission if not previously admitted. Okay, so that will complete your case of anaphylaxis. Now, these are different types of masks. This one is a non-rebreather mask, so it like carry this additional bag with it. This is a non-rebreather mask. Okay, so whenever you are going to give oxygen to the patient in the airway part, whenever you are going to give oxygen to the patient, you always ask the patient, do you have smoker's cough? Okay, so the patient says, no, I don't have a smoker's cough. Then we are going to give the patient 100% of oxygen, 15 liter per minute via a non-rebreather mask. So this is a non-rebreather mask. Okay, the patient says, yes, I do have a smoker's cough. Then what you are going to do, you are going to give the patient 28% of oxygen via Venturi Mask, and aiming for oxygen saturation of 88 to 92% until the ABG results are available. So this is a Venturi mask. Okay, it contains these one of these like things. Okay, here it is. So non-rebreather mask has a bag attached with it, and the Venturi mask has a thing like this, and there's a nebulizer mask. I'm sure all of you must have seen the nebulizer mask in their wards. So the nebulizer mask contains this container-like thing, and in this thing we always like put drops of salbutamol or ipratropium bromide, and so they are given via this nebulizer mask along with oxygen. Okay, so the nebulizer mask is not needed. In most of the stations, it's only needed in cases of asthma. Okay, but keep all these masks in your mind, because all these masks will be there on the medicine card. They will be there, and you will pick the one that is most appropriate for your patient. Okay, right. So I hope anaphylaxis is clear. We will briefly summarize it. Okay. So as soon as you enter the cubicle, for example, this is your anaphylaxis station. Outside the cubicle, it will be written that Martha, age 24, has come to the accident and emergency department with breathing difficulty. Okay, and you are NF2 in the accident and emergency department. So manage the patient and address her concerns or whatever. So as soon as you enter, and you will see that this dummy is there. So you will, you can also take a guess from the scenario as well outside the cubicle, but if you cannot take a guess, then as soon as you enter the cubicle, you will see that this Simman is lying there. Okay, so you will verbalize your name and your GMC number. After that, you will look at this monitor. And here you will find out that the oxygen saturation is low, maybe 80% or below 80%, but it will be below 90, okay? And the respiratory rate will be high, and blood pressure can vary. It can be normal, can be high, okay? So you'll have a look at this monitor, and then you will move close to the patient. You will introduce yourself. Hello, Martha. I'm one of the junior doctor in this department. My name is this. I'm one of the junior doctor in this department. Can you please tell me what is going on with you? Okay, she'll tell you, doctor, I can't breathe, I can't breathe. Okay, so you'll tell the patient, you will reassure the patient that Martha, I'm here to help you, don't worry. I can see that your oxygen is a bit on the lower side. Can you please open your mouth for me? And then you will move forward and open the patient mouth, have a good look inside it. Okay, you will find that there is swelling of the oral tissue. So you will verbalize that, Martha, I can see that your tongue and lips are swollen. And so I'm going to give you some oxygen. As your oxygen is on the lower side, can you please tell me if you have any smoker's cough? Okay, and the patient will tell you no, because it's a 24-year-old patient and does not probably have COPD. So you will go up to this medicine cart, you will pick up the non-rebreather mask and you will put on the patient's face. Okay, then you will verbalize that my patient has breathing difficulty and there is swelling of the lips. So I'm going to give the patient 1 into 1000 of adrenaline, 0.5 ml intramuscularly. Okay, and you will pick the adrenaline from the medicine cart and you will inject here, try to inject here intramuscularly, and all of a sudden the patient will stabilize. Okay, and he will start talking normally. So as the patient starts talking normally, most of the time the patients ask their doctor, what's happening with me, or may say something like, thank you, doctor, whatever. So this is your chance to take a brief history. So ask the patient what happened, then how did it happen, has it happened before, and medications, allergies, and medical conditions. Okay, then tell the patient that I'm going to quickly complete my assessment. Then go to the breathing part. Tell the patient that I'm going to have a look at your chest, please. So remove this dress and have a look at his chest, and then tell the patient that I'm going to touch your chest. If you have any pain, let me know. Do palpation, then percussion, then auscultations. So the B part is completed, the breathing part is completed, then comes the C part, check the patient's pulse. At the same time, look at the monitor, then come to the BP, verbalize it. I'm going to request new fresh blood pressure finding. Look at the blood pressure. If it is low, then start the patient on IV fluids. Pick 500 ml of normal saline from here. Verbalize that I'm going to give my patient 500 ml of normal saline over 15 minutes as his blood pressure is low, and hang the normal saline in the IV stain. There will be an IV stain there in the exam. Okay, so the C part is done, then come to the D part. In the D part, in anaphylaxis case, you will not find any like positive findings. Just pick up a glucometer and check the patient's capillary blood glucose level. Then do pupillary reaction, pupillary light reaction, and then give the patient a command like, can you please raise your right hand for me? So a D part is completed, and then you move on to exposure. You expose the patient, tell the patient that I'm going to have a further look at your skin to look for any abnormalities. So the exposure part is completed. Okay, so you followed the ABCDE approach. Now, in cases where there is blood transfusion and you can see that there is an IV stain, there is a blood set there, and the patient is receiving blood transfusion. So in that case, as soon as you enter, verbalize your GNC number, look at the monitor, find out that there is low oxygen saturation, go up to the patient, introduce yourself. Hello, my name is Dr. X, one of the junior doctor here. Is it Martha? Martha, can you please tell me what is going on with you? Martha will tell you I'm having breathing difficulty. Ask the patient since when. She will say since this blood transfusion started. Okay. So tell her that, your oxygen is a bit on the lower side. I'm going to give you some oxygen, but before that, can you please open your mouth for me so that I can have a look at it? And then open the patient mouth, have a look. You will find out that there is tongue swelling and lip swelling. And so you have met your diagnosis of anaphylaxis now. Give the patient, ask about smoker's cough, give the patient oxygen, and stop blood transfusion. Okay. And after stopping the blood transfusion, at the same time when you are stopping blood transfusion, verbalize that it seems like you have had a reaction to this blood transfusion, so I'm going to stop it and I'm going to give you some medication. And then verbalize that I'm going to give my patient adrenaline 0.5 ml 1 into 1000 intramuscularly. I know that I am repeating it again and again. It's just for your memorization. And another thing that you might have noticed until now is in Simman, you need to verbalize each and every step. So you need to verbalize whatever you are doing. Okay. So I hope anaphylaxis is clear, and I will see you next time with another Simman station. All the best for your exam.